is Coach Tess from HealthEversity, and today we are going to be doing keyword identification in Integumentary. We want to try find some of the words that you might find challenging when you read a scenario. You don't know whether it's a procedure. Even if you have a medical terminology background, A&P background, sometimes we really don't know. So we are going to be going through some of these terms that you might find pretty interesting, or you maybe want to write them down or look them up in your medical dictionary. But some of these you'll find very, very helpful with learning where there's a procedure, a diagnosis, an anatomical site. These are some of them. And this is a book that I used when I was studying for the exam. So this is going to, I'm sure it's going to help you because it helped me. This book helped me. Okay. All right. So, and I've been using it with my students for a long time. So if you notice that, on my notes, and the ones that I highlighted are in green were, like procedures. Sometimes I didn't, but some of it I just, so if you look on the wording of it, so I think keratosis, that's a diagnosis. It says premalignant of a warty lesion. So that's a body part. Something is happening with the body. So that's something anatomical. And that's a diagnosis. Basal cell carcinoma. That is something that is malignant neoplasm. So that's a diagnosis. Benign lesion. That's something happening with the body. So that is a diagnostic. Biopsy, it says removal. So the doctor did something. So that's a removal. All right, so let's look at some more words here. Okay, contact dermatitis. It's chronic, acute or chronic, caused by initial irritant. So that's a diagnosis. The doctor didn't do anything there. Debridement, very popular word. Removal. So when you see the word removal, you can see some of these terms in your AAPC study guide. So it's good that you use that glossary, right? Decubitus also, dermabrasion, that's a procedure. And it tells you right there, it is a procedure. Dermatofibroma, that's that's some type of tumor. And that is where you know that it's a diagnosis. Dermatologist. Now, that's a physician, so that's not a procedure. That is some ologist is a specialist in their area. Derma means skin. So there are specialists in skin. Dermatome, that is a instrument. It tells you right that. All right, dermis, which is directly above the epidermis. So now you can see dermis is a part of the so that's an anatomical site. HR is a thickening of the skin. Like sometimes when you get burnt and that crusty thing that come on your skin. Yeah. All right. So, keloid. Sometimes people have different types of skin, and you get a cut and that elevated thing on your skin that look like this. It look kind of like a caterpillar on top of your skin. Some people have it. That's a keloid. It's above the skin. It's a condition. Lumpectomy. So you see the term ectomy, lumpectomy. That means they're doing a removal of a tumor. Right? So you see the term ectomy, and then they're doing a lump, tumor, or other. So there's a removal of a lump. And then you see mammoplasty. So they're doing a plastic surgery of altering the breast. So it's a plasty, repair, plasty, doing a plastic surgery on the breast. And then you see mastectomy. Mastectomy is a surgical removal of one or both breasts to treat or prevent breast cancer. So before we move on, so you'll notice that when you're looking at a scenario, some of the terms might not be familiar with you, but when you're reading, when you try to read with some type of understanding, read the sentence slowly until you can pick up speed. Go into your medical dictionary, look up the terms. If it's not a is or a are and an and, look it up. Understand what you're reading before you try to go and try to look up the term and stuff like that. Read the whole scenario. Sometimes the scenarios are pretty long, but try and understand what the doctor is writing based on the procedure he performed. Right? So he needs to get paid, and you as a coder needs to be accurate. You hear the term, they say accurate, because a lot of the time when you put that code on that HICFA form, and then when you put that code on that HICFA form, then the biller takes that code, put it on the HICFA form, put the price on it, send it over to the insurance. They might deny it because it's incorrect. So you really and truly, and then insurance denies it. You need to make sure you don't get those high denials. Please make sure you read these carefully before you continue to code. Be careful. Take your time until you can pick up speed. Do not rush to go take the CPC exam just because you want to try and see if you can pass it. Take your time. That's what I tell our students. Take your time. Mammoplasty. Then look down the bottom. We see ectomy. So ectomy is the surgical removal of one or both breasts. So then look down the bottom again, you see mastopexy. It's a plastic surgical fixation of the breast. So you notice that you have mammo, you have mast, and those things has to do with breast. So you kind of have to know your anatomical sites or your body parts. So this is what is going to help you to learn your anatomical site per section. So try and focus on integumentary. What are some of these terms that you need to know? Then you move on. So we did mastopexy. Then you have necrosis. That is pathological death of one or more cells. Then you see pedal cyst. You might see that on the test, and these are tissue in the sacral. It's like where your butt is, where you sit on that area. Some people might develop a cyst right there. So those are some of the things that these are some of the words. So you can now see the difference where the cyst is something to do with the body part. So that is anatomical. That is when they say perineal cyst. That's a diagnosis. So if you say necrosis, pathological death of most, that's a diagnosis. Mastopexy, mastectomy, plasty. Look on the suffixes. Plasty, ectomy, pexy. You will see that those are procedure. The rest of them are diagnosis. So be very careful when you're trying to identify these things to code it, okay? So these are some of the procedures and diagnostic keywords that you might find on your coding exam. Please remember to subscribe to our videos and leave a comment, message us and tell us what you want to hear more. We'll be doing this as a series, so look out for all of the other sections of the CPT, and we will be here to help you. Once again, I'm Coach Tess of HealthEversity, and we look forward to hearing from you. Have a good one. Bye.